back to Face the State. I'm Ariana Bennett. Thanks for keeping it here. Well, millions of people are clamoring to get their COVID vaccines. Millions of others aren't quite so sure. And that's especially true in the Black community. So I'm back with Dr. Bio Curry-Winchell to talk about why that is. Thank you again for coming on the show.
Thank you for having me.
Now, mistrust in the vaccine isn't confined to one group or other. I imagine you're probably hearing it from a variety of people.
I am. I'm hearing it from everyone. And you know, it's important to think about when we talk about mistrust, we do think about African Americans, the Latinx community. And the reason why is we know there is a history of mistrust when it comes to really believing in the public health system. And so when you have a pandemic or any sort of new disease process that is actually, presented itself, it's really hard for people of color to really trust that, a vaccine or a treatment will not harm them. And so that's what we're seeing right now when we talk about the coronavirus.
And there's some real history behind this that probably a lot of people don't realize, and kind of all rooted in this Tuskegee study that started in the 1930s, studying syphilis. You want to kind of talk about what that was and how that all played out?
Absolutely. I'm so glad that you brought it up because, it's important to talk about these things, these events that happened in the United States. And I think when we do, that provides some life to it so people can understand why people have mistrust. And so the Tuskegee experiment from 1932 to 1972, it involved African American men and it involved the treatment of syphilis. And the men thought they were actually going to be able to get treated, that they were helping the system. And unfortunately, the study was about looking at how the disease, really just tears people apart and the complications that occur. And so these men were not privy to treatment, even though the treatment was available. And so that's something for people to remind themselves about when we talk about mistrust and why it's present.
I mean, and people died.
Yes.
Because of that. I mean, this is, I think it was in the 1940s that they discovered that penicillin was a treatment for syphilis, and this study extended another 30 years past that. So knowing that there was a cure and that they weren't getting it, and then I think more than 100 of the study participants died of syphilis unnecessarily. And syphilis is not something you want to let ride. Like, it gets really, really nasty over a long period of time.
And so they used the information that came from the complications to be able to, say, oh, penicillin works, or these are the symptoms that you will see. And the just sad part that they had a treatment available and they didn't provide it to the participants just is a really a stain on our history, and it's important to continue to talk about it. And when we talk about this pandemic right now and the vaccine, that's why a lot of people are afraid to take it, because I hear all the time, doctor, will this give me the coronavirus? And so that's where that, concern lies.
Or that it's got something embedded in it that's going to track them or affect them down the line. This general feeling of I can't trust my government, I can't trust doctors, is strong.
It is. And I think what we need to do to be able to kind of counter it, it's about representation, it's about health literacy, and just being able to have an open and intimate conversation with people, everyone. And that allows the ability to decrease the misinformation that's out there.
So how do you do that? When you say representation, what does that mean?
That means providing the opportunity for, African American doctors, Latinx doctors, every different race and ethnicity, because we do know that patients do feel comfortable if they can relate to someone culturally and be able to talk about their concerns. And if you have the knowledge, even if you're not of the same race, and you take the time to learn about that patient's history, you are more likely to make a change in that person's life just by acknowledging it.
And from the patient's perspective, if they want to get information that they can trust, because that's another big part of this. That in the information age, it's very hard to know what you can believe. They've got everything you could think of under the sun on the internet. So where can you go to find real scientific information that's trustworthy?
So there's a lot of websites out there. You know, when we talk about our community, washoecountyus.gov, as well as Immunize Nevada, and there is an amazing amount of information. There's also videos available that several community members have actually participated in, where we're able to do, you know, different topics because everybody has different questions. And so there's a video on there where we talk about, why should I trust this vaccine? How was this vaccine developed? Who was included in the clinical trials? And that can provide confidence in, you know, really decreasing that misinformation.
Yeah, it's a bit of a double whammy too, because if you have people of color who are hesitant to get the vaccine, and we also have a disproportionately high number of people dying who get COVID in that community. Do we know why COVID seems to be worse for some groups and more than others?
We do. So when you talk about why it affects certain groups and, you know, underserved communities of color, we know there's a lot of barriers that prevent access. And so if you go back to even when COVID first presented and the disparities in being able to access testing, if you didn't have a vehicle, if you didn't have internet, if you weren't tied to what we call a medical home, if you didn't have a physician, how were you able to get the information to know where to go to get tested? And so unfortunately, that has continued on when we talk about being able to access the vaccine. And so all of those barriers really culminate into a huge level of disparity in being able to access care.
Yeah, I think I read that like a Black person who gets COVID is like 1.5 times more likely to die of it, like be hospitalized and die of it, than a white person. I mean, that's a horrible statistic.
It is, and there's several reasons that that occurs, and it doesn't always have to be the community. It can also be the delay in care, and when we talk about that, that ties into that mistrust. If you don't have a healthcare provider and you're a Black man or a Black female that you can trust and you have symptoms, you may have that fear of going in and getting tested or getting treated, and unfortunately by the time you do, the complications from coronavirus could unfortunately cause death. And so that's what we're seeing, you know, a wide spectrum across everywhere.
Yeah, there's a lot of people who don't have a GP. This, I think, as you said, became very clear
right.
in the onset of this pandemic. A lot of people I know didn't have a GP, didn't have anywhere to go. What's your advice on picking one? This is something I've wondered too. I've always kind of relied on recommendations, but how do you know who's a good general practitioner? How do you pick one? How do you kind of get that medical home established?
That is a great question. The one thing that I can encourage you to do is research. Take the time, talk to your friends, your neighbors, look online and see if this person is the best fit for you. I call it a relationship. When you have that primary care doctor, they should listen to you. You should feel, you know, everything that you're concerned about, you should feel comfortable that this person is going to advocate for you. And that's who should be your primary care doctor. They are your anchor, and they are going to be the ones that really help you stay healthy, prevent diseases, as well as treat you if you get sick.
So you should shop around?
Shop around and ask. And make sure when you first go in for that appointment, make sure you feel connected, that that person really wants to help you and that you feel comfortable telling them, because they can only help you based on what you tell them. So it's a very intimate relationship, and it's one that is just extremely important.
You are setting a very high bar.
I am, and you should.
That's a lot
to expect. It's
your
life. It's your, you know, it's your health. And you are the advocate, and you want someone to give you everything they can.
It's like,
that's how I feel.
Finding your husband.
Yes.
Don't settle.
Don't settle, and make sure that person is there for you, because you are trusting them with your most intimate concerns, and you want to make sure that person can meet you and make sure that they keep you healthy.
So hard given too what a shortage we have in doctors in our community. I think, you know, and a lot of demands on doctors also to just load up their schedule, like cram in as many patients as possible. I think that's a tricky balancing act for doctors and then patients wanting to find a doctor who can take the time.
Correct. And so that's why when you go in, and even if that physician has a packed schedule, it's about the time that they take with you when you're in that exam room. If you feel that they're there for you, they're listening to you, you know you have a good fit. And that's what you want. It's important.
Okay, well, we have a couple minutes left, and I'm, would like to kind of go back to the idea of vaccine hesitancy and what your general message is to people who have concerns and kind of this history-based mistrust of institutions.
It's very important to educate yourself. If you have hesitancy towards this vaccine, the one thing that you can do is really look at the fact that the development of the vaccine, there was so much transparency. And when we talk about before, that was not always present. As well as, talk to your healthcare provider. Really take the time to ask those questions and really make the decision to say, is this the best thing for me? And if you're not sure, reach out. And that's the best way you can really, help keep yourself protected.
Well, you got the vaccine. Was there ever a moment where you questioned?
No. And the reason why is because I felt comfortable with the information. And I knew by taking the vaccine, number one, I was going to protect my family as well as protecting myself and my patients. And so that was the reason why I felt very comfortable with taking this vaccine. And I would never, encourage someone to take something that I wouldn't take for myself. And so have that conversation with your healthcare provider and, see if this vaccine is, the right choice for you.
And if we hit a critical mass of people who get the vaccine, then maybe we can start easing back into regular life.
Yes, we can, and I'm so glad that you brought that up because, we all want to return to a level of normalcy. And one thing I want to stress is even after you get the vaccine, there is that question, can I just, no longer wear a mask or kind of adhere? And one thing you and I talked about earlier, I still stress, even before the pandemic, hand washing was always important. So that's something that you always want to continue. But it's important to continue to wear your mask until we really have a level of immunity, in our states as well as across the United States, and then we will get there. I love our community. We are strong and resilient, and we will do it, and we're doing it now. And so I'm so proud of our medical community, as well as just, the people that live in the state of Nevada. We're amazing.
We'll get there.
Yes.
All right, Dr. Curry-Winchell, thank you so much. Really appreciate your time. And we are out of time, and that is it for this episode of Face the State. But for more information or to see past episodes, you can just head to our website. That's KTVN.com. Thanks for being with us. We'll see you next week.